Good afternoon, and thank you for joining us today for our coronavirus media briefing update. We are joined today by Premier the Honorable David Burt, the Minister of Health, the Honorable Kim Wilson, Dr. Ayo, our Chief Medical Officer, and Dr. Wesley from the Bermuda Hospital's Board, Chief of Staff. We will begin with our remarks from the Premier. Premier Burt.
Thank you, Ms. Adams, and good afternoon, Bermuda. I would firstly like to extend my condolences and deepest sympathies to the families and loved ones of those members of our community whom we have lost during this outbreak. All of those who have been so tragically affected by the coronavirus, including those persons in the hospital and at home, remain in my thoughts and prayers. Bermuda, we must always remember that the statistics we read and discuss each and every day are real people. They are fathers, mothers, husbands, wives, sons, daughters, brothers, and sisters. Real people who leave loved ones behind. They are friends to you and friends to me as well. Each time I hear another reported coronavirus-related death, I personally worry that it could be friends of mine who I know are battling this disease in the hospital. Indeed, this is a challenging time for us all. Tonight, I want to assure the people of Bermuda that if we work together, if we follow the current rules, we will make it through this outbreak. Students will be back in their classrooms, and parents will be able to go back to work. I know that it is hard to see past where we are right now, but we must. There are some who have asked if the government will impose stricter restrictions, such as a lockdown, to help the situation at our hospital. I am extremely concerned with what we are seeing at our hospital, but I must be honest with you that that will not change what is currently taking place there. More restrictions, such as a lockdown, will not bring immediate relief to our doctors and nurses who are doing everything powerful within their power to save lives. The hospital is currently overwhelmed due to the events that took place 3 to 4 weeks ago, where persons were not following the regulations and public health guidance that was in place, came into contact with a positive person, and unfortunately brought the coronavirus home to their families, and then it spread further to workplace and to others. The government believes that the regulations we have are appropriate, given our progress with vaccinations and increased community protection. However, this will only work if we as a community all do our part to follow these regulations. The increasing numbers in our hospital are mainly due to persons who have not yet been vaccinated with pre-existing conditions. And those persons are more susceptible to severe illness, which is caused by the coronavirus. And sadly, in Bermuda, vaccination is not evenly distributed amongst populations. And this outbreak is largely affecting the Black community, where vaccination rates are far below average. The number of positives we continue to identify is a result of our strong and reliable testing infrastructure. The fact is, however, that this infrastructure is being strained, and the increased positive cases which require additional verification are testing all parts of our testing infrastructure. The government has bolstered MDL's resources to ensure that operations can continue efficiently, and so that results again can be delivered within 24 hours. Additionally, as announced by the Minister of Health, we will transition to antigen tests for outbound travel to further reduce the burden on all parts of our testing teams. We continue to encourage persons to speak to their doctor about whether or not the vaccine is right for them, as this is the most effective way to protect yourselves from the disease, which is caused by this highly contagious virus. This is especially important for those who work in high-risk settings: healthcare workers, caregivers for the elderly, teachers, and those with underlying health conditions. Please do speak to your doctor and find out whether or not the vaccine is right for you. I'm grateful that we have seen a continued pace of vaccinations and a recent increase in vaccinations over the last month. More vaccines will be arriving in Bermuda tomorrow from the United Kingdom, which will ensure that we can maintain the pace of our current vaccination program. Continuing to increase community protection through vaccinations and continued compliance by the community of current regulations and the proper use of technologies such as the WeHealth app and SafeKey will improve the island's current situation. When used properly, SafeKey can be an effective tool in reducing the risk of coronavirus spread. Cutmatch and the Emancipation holiday weekends had no cases being traced back to those events as a result of the proper use of SafeKey and the proper enforcement of SafeKey. Businesses that have used it correctly have stayed open and seen minimal impact on their everyday operations. Unfortunately, businesses that have not used it correctly have seen positive cases and have had to close or seen significant impact on their activities. Weddings, funerals, and other events that did not follow public health precautions that were in place and or did not use SafeKey have added certainly to this outbreak. And likewise for nurseries, camps, workplaces, and raft-ups. Other settings where the law and public health guidance were not followed have resulted in a significant number of positive cases. I want to encourage all businesses to ensure that proper health protocols are being followed so they can continue to operate and staff can continue to work in a safe environment. None of us want to see local business shut down or anyone on this island be unable to work, but it is up to owners, staff, employees, and customers to all do our part and follow the rules. If you're attending an indoor venue that is not following the rules, staff are not wearing masks, they're not checking and verifying SafeKey correctly by comparing it to an ID, you could be in an unsafe environment and you are putting yourself at risk, especially if you do not have the protection against severe illness provided by the vaccine. You should consider leaving that venue and calling 211 to report the violation of law. As a community, we all must play our part in stopping transmission. And it's vital that we hold individuals and business accountable for following the rules needed to keep the community safe. Time and time again, we've shown our resilience, our strength, and our unity to get through the challenges that we face. While the coronavirus will remain with us for some time, our goal remains to protect our people, our healthcare system, to get our students back in school, and to resume as much as we can our normal lives. And certainly bring comfort and a sense of peace to our island. I have faith that we will successfully make it through this by continuing to work together as a community. I will now invite the Minister of Health to provide an update to the country on the latest coronavirus test results, vaccination certificates, statistics, and other matters from our ministry. After the Minister of Health will be the Chief Medical Officer, Dr. Ayoola Oyinloye, and the Bermuda Hospital Board Chief of Staff, Dr. Wesley Miller. Minister of Health.
Good afternoon, everyone. I begin my remarks today by offering sincere condolences to the family and friends who recently lost a loved one due to circumstances related to the coronavirus. This month we have seen quite a few deaths, and I realize that this is causing unbearable pain for so many families. I ask everyone to please keep these families in our prayers. As well, keep in our prayers those persons that are currently hospitalized with COVID-19 related illnesses. As the number of active cases increases, primarily through community transmission, we need to remember that these are not just numbers. These are people that are getting sick, and some persons are dying. I'm now going to provide some recent statistics on the foot traffic impact of COVID positive and presumptive COVID positive patients on the emergency room at the hospital. The foot traffic between the periods July 15th and July 31st shows that there were 3 COVID-19 cases that arrived at the hospital out of 1,280 emergency room visits, and the percentage of COVID cases over total ER visits was 0%. Move forward to the period of August 1st to the 3rd, the foot traffic at that period of time shows that there were 34 COVID-19 cases arriving out of the hospital out of 2,394 emergency room visits. And the percentage of COVID cases over total ER visits was 1.4%. The foot traffic between September 1st and September 20th shows 212 COVID-19 cases arriving at the hospital out of 1,341 emergency room visits. And that percentage of COVID cases over total ER visits was 15.8%. I provide this information so that the community can better understand the impact on the hospital resulting from this fourth wave. The hospital is managing more than 200 COVID-related ER visits, whilst also providing care for 58 inpatients, 14 of whom are in intensive care unit. For Epi Week number 37, which represents this period ending on the 18th of September, I'd like to add that from July 11th until the 18th of September, Bermuda's COVID-19 hospitalizations and deaths of vaccinated and unvaccinated persons is as follows. Hospitalizations, and that includes repeat admissions, totaled 183, of which 169 or 92.3% were not fully vaccinated, whilst 14 or 7.7% were fully vaccinated. There were 30 deaths in that period, of which 26 or 86.7% were not fully vaccinated, and 4 or 13.3% were fully vaccinated. This data confirms the scientific evidence as it relates to the importance of vaccines in helping to reduce the chances of serious illness and hospitalization and death. I will now provide an update on our vaccination program. We have completed week 36 of vaccinations, and since January 11th, Bermuda has administered a total of 86,676 vaccinations. And of that 86,676 vaccinations given as of September 18th, 52% were women and 48% are men. 83.8% of all residents over the age of 65 have had at least one vaccination, and 82.6% are fully vaccinated. To date, 67.8% of the population has been vaccinated with one dose, and 66.2% of the population has been immunized, namely having 2 doses. As we all know, the Delta variant is easily transmissible and widespread throughout our community. Everything we do should be focused on avoiding infection. Vaccinations are our best defense against further spread of this virus. So if you have still not decided to get vaccinated, please do your research and speak to your doctor. The sooner you get vaccinated, the better you have a chance to fight the virus if you are exposed to it. And equally important, you can protect others in our community, which is particularly important for those who cannot get vaccinated, such as our children, who we all want to get back to the classrooms as soon as possible. We are expecting, as the Premier said, a new supply of Pfizer vaccines due to arrive on the island tomorrow evening. And I encourage anyone who wants to get vaccinated to register their interest as soon as possible on gov.bm/vaccines. Booster vaccines will be made available very soon as well. At this time, the recommended target groups for booster vaccines are, and this is in order, persons who are 1, immune compromised, 2, over 65 years of age, 3, healthcare or essential workers, and 4, over 50 years of age. We are not currently administering boosters, and appointments are not being scheduled for boosters at this time. The Ministry of Health is currently working out our delivery details, and we will advise the public once they are available. Regarding COVID testing, as a reminder, community testing will be scaled back to enable the timely reporting of results, and testing is by appointment only. We cannot at this time do walk-ins. Priority for testing will be testing at the border, symptomatic cases and close contacts, exit from quarantine testing, and vulnerable essential population surveillance. And that includes rest homes, students, prisons, and healthcare workers. Asymptomatic casual contacts and safe key testing will not be a priority for the next couple of weeks. We are focusing our testing resources on the testing required to end this outbreak. If you require time-sensitive outbound travel tests, contact one of the private labs, namely Helix Genetic and Scientific Solutions, and they can be found at helixbermuda.bm, or CNS West Limited, and that's cswest.bm. Both of these labs are certified to carry out COVID-19 testing and diagnostics. To reduce the number of tests that are going to the MDL lab for destinations that accept rapid antigen tests for outbound tests, and this is all flights except flights to Boston and Canada, the Ministry of Health will be transitioning to these tests for outbound flights as soon as possible. We are aware of the importation of antigen tests for personal use, and it is important for the public to know that there are many antigen tests which, quite frankly, are fake. The Department of Health will continue to work with HM Customs to mitigate this. The national testing policy is under review now, and we will be providing the public with information to assist understanding the best use for antigen tests and the role they can play in your personal health strategy. I must emphasize the antigen tests do not and will not replace the PCR tests that the ministry uses for diagnosis. The PCR test is the gold standard. If you are experiencing symptoms, book a PCR test to be sure. I look forward to sharing more information with the community in the very near future. As a reminder, due to the high volume of positive cases, our contact tracers are focusing on high-risk settings, and anyone who has tested positive must do their own contact tracing. To assist, a new automated notification email process will notify COVID-positive patients and named close contacts of their status and their need to isolate or quarantine. Specifically, when a test result comes back positive, persons will be notified via the email address provided on their test booking. The notification email will include necessary information on the steps the person who tested positive must take regarding isolation and other matters. It will also have a link to an online form that allows the positive person to list their close contacts. These close contacts will be notified about their exposure without disclosing who the positive person is. They too will receive information on what health measures they must take. In closing, I wish to remind everyone on the basic precautions that they must take to help to stop the spread of this virus. Avoid closed spaces with poor ventilation. Avoid crowded places with many people nearby and close contact settings like close range conversations. Wash hands with soap and water frequently and use hand sanitizer when hand washing facilities are not available. Maintain 6 feet physical distance at all times. Avoid sharing lunchrooms and gatherings unmasked outside of your breaks, for your breaks. Your work environment and colleagues are not your bubbles. Masks must be worn indoors and in crowded outdoor spaces where 6 feet of physical distancing is not possible. If you or anyone in your household is feeling ill, even slightly, stay home. If you test positive, you need to isolate, even if you have no symptoms. Businesses also should be extremely vigilant and take appropriate precautions to protect their employees and patrons from contracting the coronavirus. Each of us has a role to play in stopping the spread of the virus. Please follow public health guidelines and download the We Health Bermuda app. Thank you.
Thank you, Minister. We'll now hear from our Chief Medical Officer, Dr. Ayoola. Thank you.
Good evening, Bermuda. I'd like to echo the Premier and the Minister in giving my thoughts and prayers to everyone, friends and family who's lost a loved one recently. These are indeed very tough times for us as a community. And my thoughts and prayers are with you all. I'd like to start by addressing the question I've been asked on several occasions, if the number of positives we're getting in Bermuda is not just a reflection of the high level of testing that we have in Bermuda. Yes, indeed, that is true. We are testing a lot, and we are um, therefore able to get a lot more people who are test positive. However, I believe that this gives us a true reflection of the burden of positive cases in our community. And it's better for us to understand this than many other countries in the world where testing isn't as rigorous. Uh, in to buttress the point that the ministers just made, you just heard the statistics about the footfall in the hospital so far. Um, I'll go a step further and say about half of those who end up in hospital visiting ER end up being admitted. And that's such a large number. This number could even be worse if not for the dedication of our colleagues in the uh, hospital who are able to manage these patients appropriately um, in outpatient settings by giving them things like pulse oximeter to monitor their oxygenation. Bermuda, we are in a big outbreak, and it's important that everybody takes this very seriously. Over this outbreak, we've had 107 people who've been admitted to hospital so far as of Sunday. And we have 24 ICU admissions so far, with unfortunately a few deaths as has been mentioned earlier on. I would also like to remind everybody that if you've been previously infected with COVID, that is not a guarantee that you cannot still be infected. If you remember, last Christmas, just before last Christmas, the outbreak we had was mainly with the wild type virus. The outbreak in the spring was predominantly driven by the Alpha variant, and unfortunately, the outbreak we have at the moment is driven by the Delta variant. And we have several examples of people who've tested positive at each of these outbreaks. So having been previously infected is no guarantee that you will not be infected again. I mentioned this before in the past, that your level of immunity depends on how bad your infection was. If you were not admitted to hospital, it's unlikely that you mount enough immunity to be able to stave off another infection in the future. And there's plenty of evidence now to suggest that even that if you get vaccinated after an infection, you boost your immunity so much that you are protected in the future. So Bermuda, if you've not been vaccinated in the past, this is your opportunity to do that. Can I also make the point that myself and my colleagues, both at the ministry, at the laboratories, and at the hospital, are working day and night to protect this country. We certainly do not deserve the abuse that has been given to us by members of the public. This is completely uncalled for. And I'd like to appeal to you not to do this. Everybody's working all the hours God sends to keep this country safe. The least we can do is to appreciate people and not give them abuse. It's really important that we continue to encourage our healthcare workers who are working some 18-hour days to keep us safe. It's not helpful and not good for morale when they receive abuse from some members of the community. Finally, Bermuda, I'd like to remind you that the single most important thing that you can do to protect yourself from COVID-19 is to vaccinate yourself. You heard the minister say that we're expecting new stocks of vaccines from tomorrow. If you have not yet been vaccinated, this is the time to register to get vaccinated. It's extremely important. I cannot overemphasize this. This is the single most important thing you can do to protect yourself and your loved ones. At the same time, remember to have proper hand hygiene. Wash your hands frequently for at least 20 seconds with soap and water. If you're not able to find hand washing facilities, use hand sanitizers frequently when you touch different surfaces. Remember to wear a mask at all times, especially when you're in indoor settings or even outdoors when you're not able to physically distance. Avoid crowds as much as you can. And please do not go to work if you have any symptoms. We've seen numerous examples of outbreaks starting from people feeling that all they have is allergy type symptoms, but turning out to be COVID positive and infecting their co-workers. Bermuda, be your neighbor's keepers, be your brother's keepers, be your sister's keeper, and stay safe, Bermuda. Thank you.
Thank you, Dr. Ayo. Dr. Miller, we invite you now to say a few words. Thank you.
Thanks, Dr. Ayo and the Premier and the Minister. I echo those words, and I must start by thanking the Bermuda public who have taken the advice of the Ministry of Health and the public health precautions and have gone out and had their vaccines, who have observed social distancing and regularly wash their hands at every opportunity. And when they can't wash them, use the appropriate hand sanitizers. The BHB continues to be under pressure. And as is known, last week we declared our highest level of alert, red alert, because we are at a dangerous juncture. We saw the worrying trend of the number of admissions rising within the hospital. The number of patients going to the intensive care unit increased, and I must remind people that normally we have 8+1 bed in the regular ICU, but in anticipation, watching the trend, we did create a satellite ICU very early, and then as things got further out of hand, we, in further anticipation, created a second satellite. Well, at the present time, we're using the first satellite and the second, and the main ICU is full, and the word is COVID, COVID. That's what we have. 14 patients in intensive care. These patients take a lot of resources. You need at least one nurse to one patient. So it therefore means that you have to have a minimum of 6 nurses looking after just 3 patients, but breaks have to be covered and other things, so that in practice, you will need 8 to look after 3 patients in a 24-hour period. We don't have a way of simply getting more of these highly skilled nurses. And you may recall that we closed elective surgery so as to be able to use the highly skilled nurses in the operating theater, as well as the nurses from the PACU areas and other perioperative areas. But even with that, we're stretched. We get very good results from the intensive care unit. But even then, the nature of the disease process is that patients who go to the intensive care unit tend to stay for a long period of time. We discharge a few, but we admit more. So you run into a problem where the rate at which you can discharge people is falling well behind the rate at which you admit people. Unfortunately, we have also seen some deaths from COVID within the hospital, some in the intensive care unit, and some on the acute care ward, because COVID is no joke. You can deteriorate rapidly, develop multi-organ failure, and with the best will and resources in the world, some patients get to that stage, they just don't survive. So it makes it important for all listening to realize, if you've not yet been vaccinated, go out, get your first dose. and get in line 3 weeks later for the next dose, because your best way of keeping out of hospital is to be vaccinated. You've heard the numbers from Dr. Ayo and from the minister, and it becomes very clear that more than 90% of the people who end up in hospital will be the unvaccinated. Also, they have the worst outcomes because the vaccinated ones, if they do end up in hospital, have a much shorter length of stay and in general, better outcomes. And I may give you an example of how quickly things can change. We had, over the last 7 days, Wednesday the 15th, noontime, to Wednesday of this week, a 38% increase in the number of hospitalized patients. That's a huge jump in just a 1 week period. And the trend continued to go up. In that same week, the trend in terms of ICU occupancy also went up by 27%. And it would have been more than that, but as we develop more resources and skills, some of the patients who hitherto would have gone to ICU, we are sometimes able to manage them in a high dependency situation on the ward. So the reality is even worse than it looks. The emergency department was filled with patients, and the flow was such that we had to use a tent for processing. We now have the situation where in terms of the emergency department, things have improved a little bit, and we're happy for that. However, if we look at the numbers coming through, we would see that between August and September, whereas in August, the COVID patients accounted for 1.4%, in September up to yesterday, they account for 15.8%. So that is more than a tenfold change in the percentage that COVID patients make up. And it is that trajectory that causes our greatest worry, because if it were to continue, we would get to the stage where we just could not provide the level of care that we would like to provide. Our issue is not so much a question of space, although we would appreciate if people were to take home their relatives who do not need to be in hospital, because that would certainly assist us and free up staff to look after other patients. Because our real issue is staffing. And the staffing situation has gotten a little worse from the point of view that the staff lives in the community, so they socialize within the community, and they're exposed to COVID within the community. And unfortunately, some of the staff are not vaccinated. So we have the situation whereby there are some staff who are affected by COVID, either by virtue of infection or exposure. But again, in terms of the infection, the vast majority who are infected are staff who, unfortunately, choose not to have the vaccine. We still continue to try to persuade them that the safer route to go is to take the vaccine, and in so doing, protect themselves and protect their families. For instance, we had The last time I spoke, 27 staff off. Today, I can confirm we have 59 people who are off. And of those, 66% are due to infection. The others are due to exposures, being close contacts. And of those who are off, again, I emphasize that the majority of them who were infected were people who were not vaccinated. Our way out of the problem is to observe the social distancing, proper hand hygiene, wearing the mask appropriately, not around the neck or under the nose, as we often see, but wearing it properly, and getting vaccinated and making sure that they encourage their friends to get vaccinated. And as Dr. Ayo quite rightly pointed out, even if you had an infection in December or in March, that doesn't mean that you're protected, because there are different strains, and also the immunity in most people from the infection, from all the evidence, does not seem to compare with that which you would get from the current approved vaccines. And formerly people were saying the vaccine was not approved. Well, now it has official FDA approval. So if that was a reason to be hesitant, that reason has been removed. And so I would close by asking others to do what they can to support the entire healthcare system, to be appreciative, like we are, of all our staff and all the people who work in different areas. Because although it may seem that we emphasize the intensive care, the whole system functions by having the housekeeping and dietary department providing their services. Without clean beds, clean floors, and clean sheets, the hospital wouldn't function. Without the ambulance service being very responsive, again, the system wouldn't function. So we appreciate everyone, the clerical workers who take the calls and also make things happen. And since every department has been affected by COVID in one way or the other, the message of being vaccinated is not just for frontline staff, although it's more important in my view, but it is for all of us who live in Bermuda. Thank you.
Thank you, Dr. Miller. I will now will take questions from the media, starting with Dawn Berg.
Honey,
Yes, sorry.
just have a few closing comments before we go to questions, if I could.
Oh, yes, sir.
No problem. Thank you. And I want to thank the minister, the chief medical officer, and Dr. Miller. The country certainly appreciates the valiant efforts of you and your team. And as I close, I thank all of the teams involved in testing, test results, contact tracing, surveillance, the COVID hotline, and more for their hard work, especially over the last few weeks. I've spoken to members of these teams directly, and I know that it has been extremely demanding and stressful work. The country appreciates all that you do. I also want to thank our doctors, nurses, hospital staff, paramedics, ambulance staff, firefighters, police teachers, and all public officers. You continue to go above and beyond for Bermuda and deliver the critical care and services that we need, and you are greatly appreciated. The senior citizens watching this afternoon who are afraid to leave their home, I understand your fear. The sound of ambulances racing to and from the hospital send chills to my body, as I fear it may be another case. But if you're mobile and able to leave your house for a few hours and enjoy some sunshine, there are many places that you can safely visit around the island. Our beaches and parks offer ideal spaces where you can take a chair, social distance, enjoy the fresh autumn breeze while reading your favorite book and allowing your grandchildren to ride their pedal bikes or swing. If you observe public health rules, it is safe to leave your home. To the parents working from home, trying to balance their job alongside facilitating online learning for children, I can sympathize. When I'm not able to stay home to assist my wife, I return home to see the drain on Kristen's face after being a P3 and P1 teaching assistant throughout the day while trying to balance work. And many of us, whether it's our colleagues or our staff, are facing that. And that's why we're working to make sure that we can get our schools back open. These situations are heartbreaking. I recognize and understand that this is an incredible, stressful time. And the surge of positive cases is causing anxiety. We encourage anyone who needs someone to talk to please take advantage of the emotional well-being hotline. It is available to help. Dial 543-1111, and you will have access to qualified, experienced mental health practitioners to talk to if you are feeling overwhelmed or stressed. And this line will be open Monday, Wednesday, Friday, and Saturday from 5 p.m. until 9 p.m. Bermuda, we are in a difficult situation. The division in our community will not help us move forward, and they will not save lives. What we need is unity and a sense of purpose and want for life in order to make sure that we can save lives. Our friends, our families, people around us are getting sick, and some are dying. Our neighbors are in pain. Let us think about our community and our island. It is vital that we do what is necessary to keep each other safe and to bring this outbreak to an end. We can do it, and we will do it if we commit to do it together. Thank you, and I'm happy now to take questions from members of the media.
Thank you, Premier. We're going to start with Don Burgess on behalf of the BBC.
Good evening. Health Minister, before I start my questions, I don't think I heard all the numbers correctly. I was just wanting to reconfirm. You said 58 in the hospital, 14 in ICU, but I didn't catch the number of cases from the latest report.
Thank you, John. Actually, those are still being analyzed as we speak. It looks like we will certainly be reporting a minimum of 80 positive cases, but that information hasn't been made available by the time we had this press conference. So as soon as it is, we will release it to the public.
Okay, thank you. Questions for the Health Minister or the CMO. In recent months, Bermuda Broadcasting has repeatedly pressed the government about the potential benefits of rapid antigen tests, booster shots, and monoclonal antibodies. We can now tick two of those three boxes as you have approved the rapid test and boosters. But what about a monoclonal infusion center? Hasn't this been shown to be a useful early treat for high-risk COVID patients overseas before they need hospitalization? We were previously told that this cost was a prohibitive factor, but we were only talking about a few $1,000s per monoclonal infusion, whereas having multiple ill patients spending 4 weeks in the hospital ICU is significantly more. What's your current stance? Health Minister?
Minister? Do you want me to go first, Minister?
Yes, thank you, CMO.
Oh, okay. So, well, hi, Don. We just to correct you, first of all, we've not said cost was a reason why we're not going to do this. In fact, we have made orders for what we expect that we would need on island, and that will be delivered very soon. The most important thing I need to point out is that this is not a replacement. It's not a preventative measure at all. It's meant for people who have been infected and have higher than usual risk of progressing into hospital, needing hospital care. And those are the people where this monoclonal antibodies would be helpful. It's not for everybody. And the number of people who benefit from it is actually quite small. And so therefore, the patient selection is going to be an issue. We're going to have to work very carefully to make sure we identify those who will be able to benefit from it. But it's not a panacea. The best thing is not to get COVID in the first place, not get COVID and hope that monoclonal antibodies will save you. I don't know if Dr. Miller might want to add to that, because is the hospital that's leading on this project.
Yes, I could certainly help there, Don. I was given instructions for my pharmacy to source and order it, but it was clear instruction, as I've told the Pharmacy and Therapeutics Committee. I've given them the latitude to debate and discuss it. The reality is that it would only be beneficial for a few patients pre-hospital, and you have to treat a significant number of patients to see benefit in a few. So it's not the sort of panacea. It's not like, say, if you have tonsillitis, in most cases, if you have an antibiotic, it's going to work. It's not that level of success. So it has a role, but that has been overpromised in the sense, and we wouldn't want to let people think, okay, now there's monoclonal antibody. It doesn't matter if you get COVID, you'll be all right, because that would be misleading them. Cost is not a consideration where we are concerned. If there's something that will benefit the human being and save lives and it's available, we're going to provide it. We'll work out how we handle costs elsewhere. So cost is not the issue. One, it says sourcing, but also the more important thing is to say it is new. We still have to work out the indications, and on the current evidence, it does not act as a panacea. Only a small proportion of patients will in fact benefit from it. But where we have people who are likely to benefit, and when we do have supplies, we'll be happy to give that to them.
All right, thank you. My second question, government has stopped sharing on the COVID-19 dashboard since the death toll began rising through September, which means we don't know the age range of recent deaths. Therefore, we ask, have we suffered our youngest COVID-related death during September? And have we suffered any fully vaccinated deaths during September? Health Minister?
Don, we actually have produced a chart that will indicate the statistics as it relates to vaccinated versus non-vaccinated flow through the hospital for hospitalizations and deaths. And I believe the chart was meant to be displayed on our website tonight.
Okay, but can you answer the question now?
Which part of the question? Which number?
Well, okay, did we suffer our youngest COVID-related death during September, and have we suffered any fully vaccinated deaths during September?
Yes, we have suffered fully vaccinated deaths during September. Insofar as the youngest, I don't have that information to report right now. I can't say.
Can Dr. Miller or the CMO help out on that?
Don, I certainly can help out, but as I've said, when numbers are small, I'm a little bit reluctant to give an answer that may identify and expose the privacy of the individual. But I probably could help you in saying that we have seen death in younger than the first wave. Whereas in the first wave, there were lots of people in the 80s and high 70s. We have seen death in much lower age group.
Can you say if it's between 0 and 20?
No, it's not between 0 and 20.
Okay, thank you.
I can definitely say.
All right. All right, my last question for this session. Many islanders are understandably worried about the strain on the hospital and the prospect of it being completely overwhelmed. People are anxious about what might happen if they or a loved one suffered a heart attack or stroke, for example. What can you tell us about contingency plans if all the general wards and ICU beds are occupied? I know we get the stats of the number of people who are in the hospital because of COVID, but not the overall numbers of how full the hospital is and how full the ICU is.
Mhm.
For example, would you utilize Warwick Camp or Lamfogo Clinic or perhaps the Southampton Princess? Or instead, would you plan to airlift people out? And if so, where to? In short, what's the plan for that?
Okay, thank you for that question. Very good question. So let me start by saying where our ICU is normally. Normally we have 8 beds plus 1. In other words, that one isn't meant to be used. Now we have the situation where in early we recognized that we were going to fill that ICU. And therefore, I said, we're going to create a satellite ICU as we did before, and order was given on a Sunday for it to be created. Monday it was done because it was that state of rehearsal and readiness. And as the figures went up and we saw the rapid trend, a second satellite ICU was created. So we more than doubled the capacity to have ICU patients. Our challenge with the staffing is not so much, and even within BHD, we can rapidly repurpose different areas to put more patients. So for instance, 2 weeks ago in one area, myself and the chief of nursing along with the executive identified an area, cleared it out with the help of our great cleaning staff at Biomed, checked that every bit of equipment was working, and we quickly fashioned another ward so that we have that, beds available, everything ready. Our challenge will be staffing. But we have also worked around that by saying, look, how can we repurpose the staff in a different way? So instead of having or relying purely on intensive care trained nurses to run the intensive care, we said, where are the people with high level skills that can manage that? And the answer, they're in the operating theater and the PACU, which is the recovery area after that, and the other perioperative services. So that's why you would have seen an announcement in the press that we shut down elective surgery. We don't like to do that because we know people have been waiting for their knee replacements, but you had to set out priority. If you save lives, you will then, after the crisis, be able to go back and ramp up the elective work. So we have in that way created that internal pool which we're using to man these critical areas. When we noticed that we're getting even shorter, we looked around to say, where else could you find nurses or people with the appropriate experience, or how could you pull people out and backfill? So we have enough plans. It will take us a long time to run out of physical space to put people because we can create space. That's not our problem. Where our problem would be is in getting staffing. And that is why we're now looking to see if there are sources outside of Bermuda, just in the event things continue to deteriorate. At the same time, we firmly believe that if people were to begin to observe the public health regulations, and with the reduction of movement, for instance, the nighttime curfew helped us with two things. Less partying, so that bit of social mingling and the risk it carries. But there's another bit. The late night accidents pose a problem for us because when you have motor vehicle accidents with polytrauma, they require ICU beds. They also require operating theater staff to be engaged. So rather than us staffing one emergency room. If there are lots of accidents and trauma, you now have to staff 2 emergency operating theaters. But we would rather have those staff, those nurses, those anesthetists available to help with COVID in the ICU, as well as looking after some of the critical ones on the ward so that they can make a rapid assessment that this guy is deteriorating, move him to ICU. This one is doing better, continue the high flow oxygen. So by doing a skillful dance, we manage the numbers. So for instance, at 58 inpatients, we're over capacity, but we're coping because we have set up a series of plans, A, a B, and a C, and a D. So it would take way down until we get to Z before we begin to use the Warwick Camp or, say, the Southampton Princess. In terms of Lamfogo, one of the things that we have done is to encourage those patients who have mild non-COVID problems to go to Lamfogo so that we can have our staff at the emergency department in King Edward concentrate on looking after the more ill patients.
Thank you all very much. You guys have been very patient, and hopefully I'll get a chance to ask some more questions at the end.
Thank you, Don. Thank you. We'll now have questions from the Royal Gazette. Jonathan Bell.
Afternoon. Hang on. Good afternoon. Hi, Jonathan Bell at the Gazette. Can folks see and hear me okay?
Yes, Jonathan.
Dr. Miller, good afternoon. Good afternoon, everyone. Hi. Thank you. I wanted to jump right in with the vaccines that are coming tomorrow. I don't see the health minister, but we have plenty of folks here. Fantastic news that they're coming. Wanted to know how many of them are getting here, and I guess how they'll be distributed, how we're dividing them. Are we spacing the shots out a little further to make it last? Really just wanted to hear about that to start with.
Minister, may I?
Afternoon, Doctor.
Okay, it looks like, okay, right. So we're expecting 2 trays, and that's going to give us a little over 2,300 doses of vaccines. And that is primarily targeted at first and second doses. For, we're also looking at how we can make sure that our schools are open for longer by making sure that the vaccination rates of both staff and students who are eligible students are increased. So that's the primary focus for this vaccine that we're getting tomorrow. Soon we will be getting more doses, and that will be focused on for the booster shots. But the ones we're getting tomorrow is primarily to get us out of this quagmire that we find ourselves, and by getting more and more people getting their first and second doses.
Thank you, Doctor. Any thought on spacing out the first and second dose shots?
So we have increased the spacing at the moment, and this is following recent research evidence that suggests that a longer interval between doses actually increases the amount of immunity you get. So second doses now are scheduled for 6 weeks after the first one.
Thank you, Doctor.
Yeah.
Mr. Premier, my second one would be for yourself. And thanks for having us, obviously. We heard it today in a Q&A that Bermuda is partnering with PAHO to do a joint vaccination project. I guess can you please tell us about that? Interesting to hear anything that you can say about that.
Thanks, Jonathan. That certainly would be in my remit. That'll be the Minister of Health, the CMO, so I'll defer to them.
Okay. Health Minister?
Jonathan, yeah. Can you see me, Jonathan?
I can't, but I can hear you.
You can't see? Oh, okay.
Oh, there you go.
Okay. Yeah, Jonathan, that's to promote vaccinations throughout the region and Bermuda as well. So we're trying to ensure that we do what we can to promote the importance of immunization and how it will drastically reduce the severity of COVID-19, which would include hospitalizations and deaths. So it's all to promote, continue promotion of vaccines.
In that respect, is it more the same, or are there incentives of any kind? I mean, we've gone up to 66.2%, I think you said.
Well, DCI is helping us with respect to the marketing of this, but all of us in the region have reached soft ceilings. So we're trying to address that in a uniform basis and sharing best practice and information and successes that some regions have had, and just working together collaboratively, because we all have the same common goal, and that's to increase our vaccination rates.
Got you. Thank you, Minister.
Mhm.
Dr. Ayo, the third one that I had, you earlier tonight, you mentioned there have been instances of abuse of healthcare staff. Obviously, people in the public eye, there are crazy things that happen, but I was interested to hear a little more about that. Have you been on the receiving end of something? What can you tell us about these kinds of instances that have been happening to healthcare workers?
Well, I like everybody else have been on the receiving end, but it's not really about me. It's more about my colleagues who are contact tracers, for instance, who get regular abuse when they try only to do their jobs. It's about people at the call center who get abused from people who get frustrated as well. It is across board, and it happens as well in the hospital. Colleagues in MDL lab have also told me that they get abused from some members of the public as well. It's not helpful. It's not helpful. You need to understand that. I need to state this, that everybody working on this pandemic is doing their best, and we have this country's interests at heart. It's not really helpful to us to get this kind of abuse. That's not motivation to keep going.
Righto, thank you. I believe that's my first three, Ms. Adams.
Jonathan. We have from representing TNN, we have Mr. Stefano Asanda. Stefano, he's just joining us, so you are. Stefano, you're free to ask questions now.
Hello, good afternoon, everybody. Thanks for hosting us. My first question is for Mr. Premier. Does the government support the reported move by some employers to enforce mandatory testing for their respective employees on the island?
I think that all workplaces have a responsibility to make sure they do what's necessary in order to keep themselves safe. And we leave that up to employers to decide the steps that are necessary in keeping within the law. And certainly we look at what the Bermuda Hotel Association has been able to do with their union partners. But I think the most important thing for all workplaces to do is to ensure that what is happening at their establishments are that people are following the rules. We have workplaces, whether it's from local business to international business, where people are inside not wearing masks, and we're seeing transmissions that's happening in an outbreak situation. If people follow the rules, if they do what they are supposed to do, then we will not be in the situation which we're in. And that is the most important message. If you choose not to get vaccinated, wear a mask and make sure people around you are wearing the mask. And that will help our staff at the hospital, our teams that are working flat out, and our teams at the Ministry of Health.
Have you missed, this is another question for you, Mr. Premier. Can you guys hear me?
We can hear you loud and clear.
All right. Have you given, this is kind of a two-part question. Have you given any additional thought to the call in some sectors for mandatory vaccinations for all civil service servants, as is the case in some islands in the Caribbean? And secondly, if deaths continue to increase, will the government still persist with staying clear of another island-wide lockdown?
I'm not sure if that's a two-part question, but I'll go ahead and answer. The position on the government in regards to vaccination has not changed. And what we want people to do is to speak to their doctors about what is correct and right for them. We've seen the stats. The stats are clear. We know that the vaccine prevents against serious disease hospitalization. Our issue right now is not specifically the number of cases. Our issue right now is the amount of cases that are turning to be serious and in hospital. And as I expressed through my remarks, the challenge which we have is that vaccines in Bermuda are not evenly distributed. There is a higher level of vaccine hesitancy and a lower level of vaccination within the Black community. And this outbreak and the hospitalization and deaths are impacting that community. The vaccine reduces greatly the chance for someone to develop severe disease, severe coronavirus disease, or death. And that is the thing that is most important. And as long as people follow the rules and observe what they need to do, we will move past this outbreak.
And for you, Minister Wilson or Dr. Ayo, are there any thoughts? Do you guys have any thoughts on Pfizer recently saying that their vaccine is approved for use by 5 to 11-year-old children?
I'll yield to Dr. Ayo, but I think that's extremely exciting news. And hopefully in short order, it'll be approved by the FDA, and then we'll be able to, our vaccine strategy team will meet and make a determination as to whether or not we too can follow suit likewise and immunize children at that age.
Yeah, just echoing the minister, it's exciting news to hear this. But as one of my professors used to say, I need to see your workings. I want to see the data, the primary data that this was based on, and decide if that is appropriate for us in Bermuda. It's important. The more people we can protect from this virus, the better and the safer we all are as a society.
Okay, thank you, Mr. Osanda.
Yeah, thank you,
I'm
guys.
give each of our reporters an opportunity to ask one more question because we do have a few more minutes left. So I'll start back with Dawn. We'll give you the opportunity to ask one more question since we have a few minutes left. Dawn, can you hear us?
Oh, sorry. Yeah, I can. Yes, thank you.
Go ahead. We're giving you the opportunity to ask one more question.
Okay, thank you very much. Mr. Premier, the statistics tell one story, but when we refer people in a hospital with COVID, and particularly those in the ICU, we are talking about fellow Bermudians struggling to breathe and fighting for their lives. Meanwhile, some families are having to bury loved ones. Would you care to take a moment, Mr. Premier, to underscore the reality of what's happening to people in our country right now?
I think, Don, that those persons that are on the front line might be able to, share the reality more. And I would invite Dr. Miller and the CMO, the Minister of Health. But, we know, all of us know people who are in the hospital struggling. And it is incredibly emotionally challenging. And I recognize that there are all forms of emotion and different things inside of this country, but people are dying. It is not a situation that we wanted to be in. As a leader of this government, it is certainly not a time that we want to be in. But the fact is, the power is within us as citizens to work collectively together to put an end to this. Obey and follow the rules that were laid out. We are here because that was not what people were doing. The pandemic is not over, and the coronavirus will be with us this year, next year, and possibly into the future. We see countries that have been able to get rid of restrictions in their entirety, that their community has come together and said, you know what, we want to move forward. So it is not my space to push vaccines on anyone. It is not my space to say you must do this or you must do that. Our job as the government is trying to protect the citizens of this country. And the reality is that people are dying. And most of the ones that are dying and are in the hospital right now have not availed themselves to protection of the vaccine. So it breaks my heart when I know there are people in the hospital right now who I consider as friends, fighting for their lives, who defriended me, said I'm not talking anymore, called me everything under the book, or saying you're trying to push poison on me. These divisions, it's not our place. It is a difficult situation in which we're in. And my heart goes out to the families. My heart goes out to the friends. My heart goes out to those persons on the front line, because this is preventable. This doesn't have to happen. And we must recognize that this does not have to happen. So I would yield to the others who are on the front line who've been affected in this far more than certainly myself.
Certainly, Don, the challenge is watching things unfold, but even worse, knowing where things will go, but not being able to convince those who choose to believe social media or friends who have no healthcare training nor experience, but they have great advice as to why people shouldn't take the vaccine. The false theories that people will be tracking them, that it will be affecting their DNA, that it will affect their reproductive ability or their children's ability to reproduce, with absolutely no evidence. And one said to them, okay, look at that versus the reality of people dying. But the sad thing is that while some people peddle that, we see those individuals who don't even have a chance to bury their loved ones properly in the big funerals that they would normally have, because they then come to realize that even that would be a super spreader event. So it's tough on them. And the sad thing is that even to this day, we have people on the radio spewing propaganda, which they know to be false, and people writing things on the various social media platforms, which they know to be false, without any care that in so doing, they are taking away the opportunity for many of their fellow Bermudians to live.
Thank you. CMO, did you want to add to that, or is that what do you think?
No, there's really nothing to add to that. That's Dr. Miller has really encapsulated everything. It's hard. It is hard. Many people have lost friends and family members and work colleagues. I've lost a work colleague to this nasty virus. So I know this. I know how hard it is. But I suppose the only thing I'd add is that when you say people should do their own research, do people actually understand what that means? There are people who spend their entire lives learning how to do research. A few Google page search is not research. Watching YouTube isn't research. Listening to your uncle's WhatsApp message isn't research. You need to go through every paper you see. You need to go through each reference, one after the other. There is a framework for you to read papers. There's a framework to critique everything you see. Do you do that? If you've not done that, you've not done any research. Listen to people who know what they're doing and read only from trusted sources. You can see my frustration coming through because each time I hear people say, I've done my research, I almost want to blow a gasket. You don't know what that means.
All right. Thank you all.
Don,
Oh, sorry.
that's okay. I share equally the sentiments of Dr. Miller and Dr. Ayo, as well as the Premier who just spoke. However, I think one of the biggest frustrations I have is that, we are in our fourth wave. And we've all spoken about the importance of vaccination. We've made sure that we have acquired very early on sufficient supplies for persons to be vaccinated. And we want to encourage persons to do the proper research, as the CMO spoke about, and speak to their doctors. But persons that choose not to get vaccinated, I appreciate it's a personal choice. However, the more people that are vaccinated, the more we can get back to normality. It will not adversely impact those people that cannot be vaccinated, such as children, persons that, because of their own medical frailties, cannot be vaccinated. We are our brother's keepers. And I think that, we need to ensure that we take steps, not just for ourselves, but for the betterment of the community. There have been so many people that have missed birthday parties, school trips, first day of school, sporting events, weddings, funerals, a number of things, simply because we haven't been able to get sufficient persons vaccinated so that we can try to reach some type of normality. And again, you're not doing it just for yourself. You're doing it in an altruistic way for other people.
All right. Thank you all for your time tonight.
Thank you, Don. We're going to welcome back Jonathan. Thank you, Jonathan, for your final question.
Yes, ma'am. Again, just checking my audio. Can folks hear me?
We can hear you, Jonathan.
Righto. Sorry, just checking. Okay. Dr. Miller, I believe this one is going to be for yourself. We've heard from the Premier about relief for the hospital and the healthcare staff from outside, from other jurisdictions. I guess can you tell us about what positions you need the most, how many people, how that's going to work in terms of travel, accommodation, that type of thing, or are there ways back home bring in retired staff perhaps and putting them in those places? But how are we going to be filling those gaps, and how big are the gaps that we're anticipating?
Really, at this point in time, the most critical need would be for highly trained nurses, people in intensive care or similar type training. And that would be because as the pandemic drags on, many of the people we have will just get exhausted, because as it stands now, we're fortunate to have a good bunch of young nurses, but many of them are working double shifts. So they will be doing like 2 8-hour shifts back to back. They'll do 16 hours at times. Or if they were doing 12-hour shifts, whereas in the normal run of things, they would do 3 days in a row with a break in between, they may now do 6 or 7 days in a row. So by having more ICU type nurses, that would help. People in the pharmacy area would be beneficial as well. In terms of doctors, we're doing okay at the present time, and we don't anticipate a great slippage there. So our main concern would be nurses. Physiotherapists, a few would be helpful, but those that we have, they're working at capacity, and they will also teach some others how to do some of the other things, just like they teach patients. So our big area really is critical care nursing. And in terms of accommodation, accommodating them on the island won't be a problem. Bermuda has enough accommodation, and we can work that out. BHB would be grateful to have them, and we'll do whatever it takes to accommodate them.
Am I correct that we're seeking them now?
Yes, we are seeking them now.
Numbers perhaps, or can you tell us?
Whatever we can get, whether we can get half a dozen, 20, we're happy with whatever we get.
Whatever
if we get 6, have. If we get 12, it's 12 that we didn't have. If we get 20, we're happy.
Retired staff, do we have recourse to people who've...
Well, we've certainly been looking at retired staff. We don't have that many retired staff on island who would be coming back. But we have looked at retired staff, and we have been asking, and there are a few people who are semi-retired. And so as recent as yesterday, one individual gave a commitment to come back, but only for half a day. So that individual would work up until 1 o'clock. Well, we grabbed that with both hands. We weren't going to argue that you have to be able to do a whole day. Half a day helps us very much, especially in certain areas where we were short. So that person was not in intensive care, but by working in another area, it allowed us to repurpose some staff. So we're open to the idea of having retired staff where they're available, but they're not that many on island.
Got you. Doctor, thank you.
Thank you, Jonathan. Okay, our final question comes from Stefano, who is representing TNN. Go ahead, Stefano, we see you.
All right. Hello again. My question is another one for Premier Burt. As tourism comes under your umbrella, can you break down the impact for us of the cancellations of events such as the World Triathlon Championship? And what do you see as the fate of the Bermuda Championship, which is scheduled for the end of next month, being at this point in time?
Thank you for the question. And it is a very good question. Certainly, the decision to to postpone the World Triathlon Series was not one that anyone would welcome, just in the exact same way that the government not welcome and or desire what is currently taking place and which is affecting most seriously our hospital. But what I would say is that from a tourism perspective and the messaging that is coming out from the Bermuda Tourism Authority and myself is the message that I would give to the public, that persons who obey the rules and persons that do what is necessary, persons who are vaccinated and visit Bermuda, Bermuda is a safe place. And during this outbreak, we've done the figures, only 1 in every 555 tourists have tested positive while they are on island. 1 out of 555. That is 0.18%. It's a very, very, very small number. So Bermuda is a safe destination for tourists, and is all persons, if you go ahead and follow the rules, you will be fine. That is the message that our teams are making sure that we relay to the PGA. I'm not trying to put too fine a point on it, but there are many PGA events that take place in the United States of America where the situation in regards to transmission, et cetera, is at our level or worse than where we are right now. And so from our perspective, what we are doing is we intend to have the PGA event. We want to make sure, and it is vital, that all persons of the country, our visitors, our residents and others, follow the rules that are in place. When you follow the rules that are in place, you minimize the risk of transmission, you minimize the risk of spread, and you minimize the future pressures and impacts on our healthcare system, and most importantly, our only hospital. So I thank you for asking that question. Certainly,
thank you very much, guys.
Yeah, the World Triathlon Series was not something we wanted to do, but we are confident that we'll be able to hold the PGA Grand Slam, and also confident to see possibly without spectators, but after, we put in testing in a little bit to see the return of some local sports as well. We want to get back to life. But what we must make sure we do is that we do it safely and with precautions which are necessary to ensure that it does not put further stress and pressure on our healthcare system.
Thank you, Stefano.
Thank you very much, guys.
Thank you to members of the media. I now welcome our panel to have closing words. We'll start with you, Mr. Premier.
Thank you very much. I want to thank the entire team, certainly for the work of which they are done and continue to do. And certainly I want to thank the Minister, the Chief of Staff, and the CMO. And I wish everyone to please follow the rules and regulations which are laid out by the Minister of Health.
Thank you. Minister?
Thank you. I too would just like to echo the sentiments of the Premier to just remind persons that, the control of next steps is in our hands. And if we take steps to ensure that we personally adhere to the public health guidelines, wearing our masks, washing our hands, physical distancing and the like, I think that would be critically important to us helping to scale off this wave, and certainly most of all, encourage persons to speak to their doctor and make a proper decision to be vaccinated.
Thank you, Minister Wilson. Dr. Ayo?
I certainly would echo everything that the Minister and the Premier have said. Just to add that COVID isn't going away. We can't magically wish that it will go away. We have managed as a country to deal with 3 waves of this nasty virus in the past. We can't kick this virus. So we need to do what is required of us. I'm sure everybody by now knows what is required. It isn't going away. We need to be able to live our lives even with this virus around. And there are ways that we can protect ourselves. We all know that. We need to keep not just ourselves safe, but we need to keep our families, our work colleagues, and all of our society safe. Please follow the rules. Please get vaccinated if you've not been vaccinated, and look for information from reputable sources. Please. Thank you.
Thank you, Dr. Ayo. Dr. Miller, would you like to comment?
Yes, certainly. Thank you very much. I would certainly agree with every word the Premier, the Minister, and Dr. Ayo have said. And I certainly take the opportunity to thank the Ministry and the Public Health and the government in general for the efforts that have been expended in trying to bring this pandemic under control. It's not going to happen in just one day or 1 week. So it does require some patience. We have to adhere to the public health guidelines, frequent hand washing, social distancing, wearing the mask and wearing it properly, not under the chin or around the neck. And take the opportunity to get vaccinated. There are so many countries in the world where people don't have vaccines. They would love to have it. Access is not a problem in our case. It is available. Here at VHB, we have gone out to set up clinics at different times, even on the weekends, to make it possible so that somebody can say, I'm busy during the week. We have weekends. So it's the thing that everyone should consider. And also, I would want to end by reassuring the public that they should not panic. We're still open. If you think you have a heart attack, an appendicitis, or some other serious condition, don't stay away from the hospital and suffer or die. We have provisions to look after you. We have been repurposing things and positioning ourselves that while we deal with the pandemic, we recognize that other things have to take place, and we do deal with that. So don't stay away if you have a serious condition. Similarly, don't panic that how will we treat you? We have ways of doing it. We will give you the care. At the same time, I appeal to everyone who has not yet been vaccinated, go and get the vaccine. It saves lives. Our data has clearly shown it. The data from elsewhere has clearly shown it. Don't take your education from the social media or the internet. As Dr. Aya pointed out, reading a few articles without even knowing the qualification of the people who write them, that's not research. Similarly, even when it is done by supposedly qualified people, studies have to be done in a certain way in order for them to have validity. In other words, if not done properly, the conclusions drawn will not be proper. And the story of ivermectin, thankfully, I've not heard much about it in the last few weeks, although some people had it on social media as a gospel. It is useless. It can cause great harm. Do not take it under any idea that it will prevent serious disease. Similarly, the monoclonal antibodies are there as new things, but they're very new, newer than the vaccine, with less evidence for the efficacy than the vaccine. Yes, they have a role, but it will not prevent you dying. So it may keep a few people out of hospital, but it is not the sort of thing to say, if you don't take the vaccine, it's all right because the monoclonal antibody will save you. That's a dangerous route to go down. Take the vaccine. It saves lives. Thanks.
Thank you, Dr. Miller. Premier, I welcome your final comments. Premier, I don't think your mic is on.
All I have to say is thank you, Bermuda, and good night.
Thank you to everyone. That ends our press briefing today.